So they gain savings by owning the equipment instead of renting it. They take on risk because now you own the equipment and you don't have that same level of flexibility. But the transition is simple because the challenge of training the operator and having them available is removed. It's us. It's the same person that was running it before, same physician interaction, same knowledge of the device, setup, tear down, troubleshooting, all those key aspects.
Clock in, scrub up, and join us behind the red line. You're listening to First Case, a perioperative podcast bringing you exciting interviews, engaging discussions, and innovative solutions that are changing the way patients receive surgical care. Each episode, we talk to frontline staff, perioperative leadership, and nursing entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the back table to the boardroom, from wheels in to wheels out, we tackle the real-life issues affecting the OR. Whether you're tuning in for surgical service education or inspiration, we're glad you're here. And now it's time to roll back and start the first case.
On this Vendor Spotlight, we are going to be speaking with Casey Branham, Vice President of Service Solutions, and Kanoe Russell, Director of Solution Management with the Surgical Services Division of Agiliti. And this conversation really piggybacks off a prior interview that we had a couple of years ago, Melanie, with one of their colleagues at Agiliti. So stay tuned and we'll remind everybody about how to listen to that episode. But today, listen to this one to see how Agiliti has positioned themselves in a very unique way to support laser safety and increase quality and flexibility and efficiency related to your laser safety program, but also just understanding how to manage this equipment. And have you ever run into that scenario where one surgeon wants to use one piece of equipment and another surgeon wants to use another and you can't get that standardization? Agiliti's got a solution for that too, Melanie.
They do. And they've paid attention to the pain points that we have in the operating room surrounding our lasers. And they have come up with incredible solutions to, like you said, improve our quality and improve efficiency and really make sure that we have what we need for each and every one of the cases that we are doing that needs a laser.
All right. We're going to be right back with Casey and Kanoe. Stay with us.
From the studios of Healthcare HQ, you're listening to First Case.
We are speaking now with Casey Branham as well as Kanoe Russell, and we are going to be talking about lasers today and all things lasers. So Casey and Kanoe are really excited to have you on the show today. And I think, Kanoe, maybe we'll start with you. Just introduce yourself and tell everybody a little bit about your background.
Yeah, thanks, Justin. First wanted to say, thanks for having us on. We're really excited to be here and we're looking forward to our conversation today. As you mentioned, my name is Kanoe Russell. I am the Director of our Surgical Services Solutions here at Agiliti. My role within the organization is focusing on where we can strategically enhance and expand our portfolio of offerings, whether that's adding new products to our bag or enhancing the services that we can provide for our healthcare customers. Been with Agiliti about 5 years now, and my background has always involved the OR in some capacity. First started out at a pulmonary imaging company where we could render 3D images of lung CT scans to help physicians quantify diseases within the lung or help them navigate that anatomy as they perform bronchoscopies or other procedures. So that experience has lent itself well to my current role now, where we help our customers get access to the surgical technologies that they need for their procedures, as well as the management of those devices as well.
And Casey, we'll hand it over to you as well. Why don't you talk about your background, how you find yourself in your role with Agiliti today, and tell us a little bit about your career.
Yeah, awesome. Thanks, Justin. Kind of oddly enough, I started in medical lasers 20 years ago with the LASIK industry and ambulatory surgery centers. So I've been working in or around medical lasers for 20 years, 13 of which I've spent here at Agiliti as we've grown this solution with our customer partners.
I know you're both kind of in that surgical services business. What's the footprint there? Like, how many cases are you supporting every single year? And maybe we can talk more about, just kind of your approach to laser safety and education as well.
Justin, we support over 130,000 cases annually, largely focused in urology, ENT, oncology, and gynecology. Our approach to laser safety started in 2012. In visiting with customers, we identified that laser safety officers were burdened with oversight, ANSI standard compliance for complicated laser programs. With very little formal education around staff training, capital acquisition, or how to manage third-party vendors. Understanding those challenges, we identified that supporting the laser safety officer with data and formal education was something we could help with.
Yeah. If I could add to that, Justin, Casey mentioned that we support over 130,000 procedures annually, and we do that through our team of laser technicians that we have at Agiliti. We have over 450 laser technicians that are OEM trained and certified to support the laser and the procedure that's being performed. We have the largest laser technician team in the nation as well. And so that's a little bit more about our infrastructure and how we can support our customers.
And when you talk about the kind of training, I know like for a lot of other professions, you get like professional trade organizations, there's certifications. Like, who's kind of the body that oversees laser safety?
Justin, the ANSI standard Z136.3 covers the safe use of lasers in healthcare environments. The standard currently requires a laser operator to be certified in both the device and the procedure they are supporting. The certification steps or time commitments are not clearly defined. So you have a certified operator who may not be positioned to properly support a surgical case.
So Casey, you mentioned the ANSI standards. And, obviously the Joint Commission, when they do surveys, is going to look and make sure that you've got a program in place. And you talked a lot about taking that laser safety officer and giving them the training and the tools and the resources that you've put together to help them function. But is there like a certification, or how does that all get governed, in that way?
Justin, you're right. There's key aspects of the ANSI standard that are covered, by your point, by the Joint Commission, but also OSHA enforces many of the standards. For example, leaving a key in a laser is something that violates OSHA regulations. For operators, there's no central or formal device procedure certification body. And that leaves windows where some operators can be certified, but not properly prepared to handle laser error codes or the challenges you might see in a regular case. This challenge is compounded for facilities where they need to either work with an OEM for training or decipher the manual to create their own training. We have great confidence in our laser operator training, and we know that their years of experience help them perform exemplary work, including the troubleshooting section.
So there's just a high degree of variability in terms of quality control here.
Absolutely.
Melanie, what's been your experience with lasers in the operating room kind of related to this?
Okay, well, one, I think that there's a lot of misunderstanding and confusion as to what it takes to be a laser safety officer. Case in point, when I was the manager of an OR in Texas, I was told, hey, you have to have a laser safety officer. I'm like, what is that? What do we need it for? They're like, well, they just have to give a test every year to make sure that everybody is compliant with the laser. So you just make sure that somebody administers this test every year to everybody for our competencies, and they'll be fine. And that was like my understanding of what we had people overseeing for our quote unquote laser safety officer. But in reality and practice, when they wanted to use the laser, we were just there to make sure we pushed buttons or, had things available for them. And it was very, what's the word I'm looking for?
Uncomfortable is the one I usually get.
Yeah, very uncomfortable and very disturbing, because you're like this thing can hurt people and damage patients and people's eyes and all of these risks that are associated with the laser. And here we are saying, you just need to take a test every year to make sure you're competent. And then whenever the surgeon says push the button, just push the button. And that's really okay. So yeah, that has been my disturbing experience in the past.
Yeah, it's amazing how hospitals overlook all the challenges from, an engagement of the employee perspective, how they feel about it. And then taking it one step further, what's the real cost of having somebody in that room? Because while you're in the room, if everything goes okay, then I guess it doesn't really matter, right? Like everything got through and the only negative is the teammate is sweating bullets the whole case, hoping there's not an error code or the energy transmits correctly and the tissue interaction's perfect. All these things that a trained operator looks at and handles without a problem.
Yeah. And when I would be in an OR having to be the person overseeing that laser, I've already got all this other stuff I'm doing. And then all of a sudden I've got to be paying attention to when they want the button pushed, or is it on? Is it off? Am I doing this? And I really hoped I never got an error code because I didn't know what to do if I got one. And our surgeons weren't really known for being patient enough for us to troubleshoot if there was a problem. So you really didn't want there to be a problem because you didn't know how to solve it if you got one.
Yeah, and Melanie, you're in the window of time when the lasers were not super complex either. It was basically hertz, joules. This is the simple math equation. Now, as we've witnessed a significant amount of technology hit, especially the urology space over the last 3 years, the power of the laser and the complexity to operate it has grown exponentially. So it becomes a real challenge for the model that was, hey, this person kind of knows what they're doing. They're certified. We're good.
How much variability is there from one manufacturer to another in terms of operation too? Like, is some of that training specific to device, and as they become more complex, there's a greater degree of variability just from which one they're using?
Absolutely. Each manufacturer, each wavelength, each console, they have different settings, different risk factors for the patient. It's something we have to be really diligent as an organization to train our people on to make sure they're proficient. And then, of course, troubleshooting. So when something goes wrong with the laser, somebody needs to know exactly, number one, what's going wrong, and then two, how to fix it so you can get through the case appropriately.
I'm just thinking about product evaluation, like the time commitment required to evaluate, like, okay, we are going to buy new. And you were just kind of talking about this, like, you don't even know if you're going to buy it, right? This is an area where you really support the customers is you're not sure you want to buy it. Well, if you're going from a 3-hour to a 3-day training as you're going through that evaluation, that's a whole different time commitment for the hospital. And then what if they spend all that time and then they decide that that's not the one they want? Like, do you help them in your program figure out which, laser is the right one for them that they like as they're going through that evaluation process? Is that something that you do?
So we do work with our customers to, trial different lasers and different products that they might be interested in. They could also, utilize our rentals to be able to test some products out. And then we also can provide consultative services and just be able to recommend some devices and some equipment that they could purchase based on their utilization and the procedures that they're performing at their hospital.
Kanoe hits on a very good point. One of the things that we are lucky to be able to provide is basically everything in the marketplace that matters. So for the hospital that's looking at 3 different urology lasers and they've trialed each and they can't get their urologist to agree on one, that's okay. We're Access. We can allow you to take each one. And if you decide that you want to just continue to rent and allow each doctor to use the device they prefer, that works because we have them all available. Or you can get to a model where you decide, hey, everybody's comfortable with this one. We're going to go ahead and make the investment. And then at that time for the facility, the easy button is just a transition to our operator stepping in and running that owned equipment. So they gain savings by owning the equipment instead of renting it. They take on risk because now you own the equipment and you don't have that same level of flexibility. But the transition is simple because the challenge of training the operator and having them available is removed. It's us. It's the same person that was running it before, same physician interaction, same knowledge of the device, setup, tear down, troubleshooting, all those key aspects.
You really can't understate how important it is from a OR circulator and scrub and OR team point of view to have that responsibility taken off our shoulders, to have somebody else who is trained on that device, who knows it inside and out, who can handle it during the case, who makes sure it's in the room, who gets it out of the room, who does all the troubleshooting, has all the equipment, knows the fibers, all of the stuff that is needed for that machine. And they're the experts and they're there to help. And you don't have to worry about facing the wrath of someone should you not know what you're doing, and you just kind of have to guess. And so to really have a trained expert who focuses on that laser in the room when you're doing a case with a laser is just a sigh of relief for the clinical staff.
Definitely.
Yeah, it's the ability to sleep easy, right?
Yeah.
If you're the
Well,
OR director, when I managed ASCs, anything that you could eliminate that could go wrong was one big win, because there's so many things that go on in an operating room. Most of the time the patient's under, they don't really know everything that's going on in there. And, there's a lot of gymnastics that goes into a successful surgical case that, luckily as the patient, you never really know about. They just wake you up and tell you everything went well.
So I think one of the things that I'm hearing you say, which is really different about the way you support healthcare organizations across the country, is you're really vendor agnostic with a much higher level of service. And so you can give them confidence that they have the right product and they understand all of the needs and the demands on utilizing it from one manufacturer to another, but not just that they get training, but that you can actually support them and execute on that, especially at facilities that have a higher degree of variability from a lack of physician sort of alignment on a particular manufacturer. I feel like that's where they really run into issues.
Yeah, that's correct, Justin. You hit the nail on the head.
All right. So one more thing, as we're talking about the value of the laser operator being in the cases with our staff and helping out our teams. Sometimes I think that hospital leadership kind of gets confused maybe about the role of that operator for the laser. And because we are required to have a laser safety officer, I think sometimes they think that since there is a laser operator coming in, that they can fulfill that role. But that's not actually the case, is it?
No, it's not. And that is a very common misconception in the industry. The ANSI standard governs that if a hospital rents, owns, uses medical lasers, they have to have a program that shows governance of that. And that is what the LSO is charged with. What we do as a group is we make sure that we are continuing to feed the LSO the right data that shows that we're on time for cases. We're executing all the safety pieces. We know when something goes awry and we have a CAPA that comes off of it. That's all the aspects that are critical to showing that you govern the program.
And it's very helpful to have all that data to be able to show your laser safety officer to have on hand and to get from the experts who are running the machines. That's really awesome.
Yeah, the administration and the supply chain. The supply chain benefits from the data because they gain confidence in that rent buy cost equation savings model that they're trying to achieve.
But the hospital really appreciates it because we take a lot of burden off of the hospital staff and the LSO with our program. I think we measured it, Casey. I think it was about 1,500 admin hours per year for a laser safety officer to be able to train and validate the competency of the training of their laser operators on their staff. And so knowing that our staff, our laser technicians are already trained and certified on both the device and the procedure takes that admin burden away from the laser safety officer and gives them their time back to devote, to patient care or other core responsibilities within the hospital.
Yeah, I love that because you do it on a certain scale, that, that kind of competency piece is something that you've really refined, I'm sure. And as you have a laser safety officer, there may be turnover in the organization. They are continually trying to reset the program. You're just providing stability, soup to nuts, that it's always being implemented, at the same consistent standard, throughout the entire life of the program, which obviously is continuous at this point. I'm also thinking about the fact that you have this unique position where you're working with all of these different manufacturers. Like, do you have relationships with the manufacturers? Is that partly how you get some of your training? Does that allow you to sort of improve communication between manufacturer and the clinician and provider themselves? How does that play out?
Yeah, we have contracted partnerships with all major OEMs or original equipment manufacturers in this industry. Brand names such as Boston Scientific / Luminous, since they acquired Luminous in 2021, Olympus, Dornay MedTech, Varian, just to name a few. And yes, to your point, Justin, those contract relationships allow us the ability to train our technicians to the highest standards because we partner with our OEMs to develop the training and the certification requirements for our laser technicians. And so we know that they're trained and certified to the OEM standards for every procedure that they're supporting.
Oh, that's great. I'm also thinking you're getting an inside look at the new technologies that are coming down the line and sort of understanding what technology is in place. So are you advising customers on, hey, this is a good improvement, but you're like right behind it with your latest model. You might not need to do this one right away. Or, hey, you're like 5 generations behind. And while it wasn't a major difference over the last 4 generations, this one is a big leap forward that you should consider. Are those the kinds of conversations you're having with your hospitals?
Yeah, definitely. There's some lasers that are like cell phones where, the next generation comes out every other year. And so we want to make sure that our customers are educated and aware of those kind of new technologies that might be in the pipeline that they don't have visibility to yet. Other technologies have kind of a longer life cycle. And so we can advise our customers based on, again, the utilization and the types of procedures that they're performing and the types of technologies that they're interested in, whether to purchase or to rent for the time being. And we can kind of help them navigate through that space and plan for the management of that laser if they're going to purchase it as well.
You mentioned some of the analytics, but I want to dive a little bit further into that because I think and it's really on the heels of the question I just asked, but making those strategic decisions for the organization, I'm wondering, what kind of data are you looking at? I'm assuming that it has a lot to do with operational efficiencies in the operating room, especially as budgets are tightening significantly right now, coming on the heels of negative margins and operating margins over the last several years. Is that really, are there other areas that you're focused on, or is that really the core of, some of the analytics and the strategy discussions you're having?
Justin, the basis of the analytics kind of goes in 2 platforms. One is for the clinical team. So that's around access. How quickly do we say yes when they call in the order? How efficiently do we execute the case? We provide them some kind of that checkbox documentation that, hey, this person was certified on this procedure. This is how often you do it. This is the time that it takes. All those operating clinical metrics. And then there's a second set that goes back to your prior comment around helping them understand the technology landscape. The challenge most urology coordinators right now in particular face is just this flush of technology into the space. It used to be 1 or 2 options, and now it's 10. And it's, iterations and differences, and, some work better on a hard stone, some work better on a soft stone, physician preference. There's a lot of complexity to it. So what we can share with them through the analytics for the supply chain, which is the other column that we support, is helping them understand that rent-buy decision and giving them some confidence when they decide to pull that trigger and the option that they decide to select.
Now, I know we talked about supporting 130,000 procedures, but is your program really limited to the operating room, or is it expansive?
It's not just limited to the operating room. There's other sites of service that we can provide, such as the ambulatory surgery center will be another major site of service for us. Sometimes physician offices as well. But the OR is our main point where we help our hospital customers.
So I see that you have 150 service centers around the country. And I think, folks will appreciate that national footprint. But honestly, I don't really understand what that does for the customer. How does that help you in your operation and sort of the quality of the delivery of the program that you have?
Yeah, the advantage of the 150, service centers is the fact that, we're local to our customers. In fact, over 90% of all acute care facilities in the U.S. are within a 100-mile radius within one of our district offices. So the fact that we're local means that your equipment that you rent from us is not traveling, across multiple states. It's going to be within that district. It's not going to be sitting in a hotel. It's going to be in one of our district offices, secured. And as well, we also can provide fast local response. So sometimes our customers will schedule cases with us days in advance. Sometimes we have less than 24 hours or sometimes less than 6 hours notice, and we're able to cover those cases and meet those responses for our customers because of our local presence within that market.
So one thing that also perked me up as you were talking about delivery of lasers, having them when they're needed, they show up when you need them for a case, and then they leave again, is very nice when you have the perpetual problem that every operating room has of lack of space. Because when you have those big lasers that are sitting in your equipment room, taking up space so everything else can't go around, or they're getting hit with stuff left and right because you're trying to push a microscope up next to the laser that's sitting there. And I said that from experience because I have run a microscope into a laser before. So just saying I've done it, knowing that they're there on time. They show up for the case. They come with an experienced person to run the thing. And then it is taken off site at the end of the case or end of the day, whatever that may be. That just really is like a breath of fresh air to, I have more space now in my storage room because I have what I need for my case. And then it goes away, which to me, with all of the problems I've run into over the years with limited space in the OR, but also wanting to make sure that I have the equipment that I need for my case when I need it, it's like, this is perfect. I love this.
Yeah, that's one positive feedback that we've always received from our customers is the fact that, we're able to take away that administrative burden for them just around, managing lasers, right? Like we show up an hour before the case starts to be able to set up the laser, test fire it, make sure that it's case ready. Obviously, we're there during the procedure to operate the laser on behalf of the hospital staff and to troubleshoot the laser should any error code pop up. And then, of course, after the case, to your point, Melanie, we tear down the laser, we wipe it down, we then mobilize it out of your facility so that it's not in the way. I mean, there's so many times where I've been in a hospital hallway in an OR and I've seen lasers or equipment just sitting in the hallways. And it's like, okay, lack of space, to your point. And so the fact that we're able to kind of remove that burden away from the hospital staff, I think is a win for everyone.
Absolutely.
I feel like another thing with that service piece is just there is obviously a major staffing crisis right now. I mean, hospitals are really struggling with that. Do they have to have equipment to be able to get that service from you all?
So with our equipment rentals, we can also provide tech-only services. So that's when the hospital owns lasers, but they don't have staff to be able to run those lasers. So they can have our technicians operate their owned lasers for them, so that they, have optimal operation during the procedure and they don't have any additional staff burden. And it might be kind of timely because we know, there's kind of a labor shortage, staff shortage in the healthcare industry. Our tech-only services can help with that as well.
So Casey, another area that I'm always really focused on, partly because, I host another podcast, Power Supply, which is focused on supply chain. And I have a lot of conversations just about the bottom line and the fiscal well-being of healthcare organizations. And I know like a lot of times supply chain's got to be a master of many. And if you start to get into a complex sourcing initiative, it's really difficult to just understand the true cost, especially when there is like a service and, how you operationalize a technology. Then you start to get into this blend of capital and purchase services, which gets really confusing. Can you talk about how you kind of support with total cost of ownership analysis?
Yeah, Justin, you must spend a lot of time with supply chain leaders because that is one of the number one things that they bring up that they don't fully understand. When it comes to lasers, there's the risk of obsolescence. There's the risk that a physician just decides tomorrow they want to use something else. And that's a risk that you don't have with infusion pumps and ventilators and those kind of things. So it's hard for a supply chain leader to really map out what's the length of time I'll be able to use this device. And beyond that, the cost of maintenance and repairs on lasers is significant. And then that only goes up if you have an operator in there who can't do simple troubleshooting. You're going to generate more service calls, more expense. And again, really hard for somebody in supply chain to frame that out appropriately.
Well, Agiliti is a recognized leader in the field of laser safety, and Melanie and I have firsthand experience with that. As we mentioned, we had a colleague of yours, it was Richard Gamma, who's your director of laser safety, on an episode of First Case. I want to say it's been a couple of years now already. And I remember how much fun it was because he has prior radio experience. So he made Melanie and my job really, really easy.
Oh, yeah.
I want to call out that episode just so that folks can kind of go back and listen to that if they've downloaded the smartphone app for iPhone and Android for First Case. But the episode is titled Protection and Prevention, Understanding Laser Safety in the Operating Room. But we don't stop there on this particular episode because you've got a number of resources that we're going to have links back to. I think we mentioned the Laser Institute of America, that you've been partnered with them for ongoing medical laser safety officer training. And so that there's safe and effective operation of these lasers. But additionally, you've put together a medical laser safety checklist. So I just want to point this out, that if the listeners go to the episode description, they're going to get links back to this. You also have a webinar on the laser safety program, ANSI standard. So you're providing guidance about that. And then some other links as well, the role of the facility medical laser safety officer. So you've outlined that. So Melanie, to your point, like, yes, they still need one. And what does that role look like? Definitely everybody can check that out. And then also some laser safety program structure that's been recommended by you all. So, I mean, honestly, if anybody's listening and they're feeling like they don't really have a proper laser safety program, you've got all the resources for them. And I know that they can also reach out to you. Before I send them in your direction with email and website and phone contact information, I just want to say, I think you all have really established a niche in this space to provide some really comprehensive nationwide support. And I want to commend you both. You're both clearly experts on the topic. And I wonder, is there anything, maybe we start with you, Kanoe, anything that you feel like needs to be added before we wrap up to the conversation?
No, I mean, just, back to our original kind of value proposition is the fact that, we're access. And so we just want to make sure that everyone understands that, we can provide the access to the equipment, the technologies that, are needed when they're needed for all the procedures that, are performed at the hospital. So just look to us for the access that you need for the equipment that you want.
All right. And Casey, any closing thoughts? I want to thank you both for coming on the First Case podcast today. Excellent job.
Justin, thanks. I would definitely recommend anybody who gets an opportunity to listen to Richard Gamma to do so. If you're interested in lasers, laser safety, all things in the operating room, Richard's beyond the expert. We've all learned a ton from him. He speaks for AORN at the Laser Institute of America, the International Laser Safety Conference. That podcast is one I would definitely reference if I were interested in laser safety.
All right. Well, I do want to remind everybody that they can visit agilityhealth.com to learn more about your surgical services solutions and the full suite of products and services to help improve quality, reduce costs, and elevate patient experiences. And if you want more information, you can give them a call, 1-800-847-7368. You can also send them an email, info@agilityhealth.com. I will spell that out. It's AGILITI health.com. And you can also follow them on social media. Find them on LinkedIn and Facebook. Thank you both again. Great job today.
Thanks, Justin.
Thanks, Justin.
That was Casey Branham, Vice President of Service Solutions, and Kanoe Russell, Director of Solution Management with Agiliti's Surgical Services Division, talking about laser safety. Melanie, you and I had a great conversation with Richard Gamma a couple of years ago. They really are leaders in medical lasers and safety and training. I love all the resources that they pointed out that are going to be available to our listening audience. And I do want to encourage everyone to go back and listen to the episode with Richard, Protection and Prevention, Understanding Laser Safety in the Operating Room. It highlights maybe in a little bit more depth a lot of the issues in the industry today around standardization of these programs and delivering high quality that we touched on today, but talking more specifically around, how this unique position that Agiliti has in partnering with the manufacturers and the OEMs, but also providing on-site support and really being able to maintain the quality of your laser safety program consistently over time. I just think about that turnover piece, and it's always such an impact when you have a great leader. Maybe that's the laser safety officer, then they turn over, and it's almost like you have to rebuild the program from scratch, and they can really help steady that hand.
Yeah, I think there's a lot of peace of mind and a lot of relief of burden when you have someone else handling this aspect of surgical care. But, you think about nurses and other staff in the room. We are not always trained or certified to operate lasers, but we get asked to operate them a lot. But when we do that, we increase our patient and staff safety risks. This increases our administrative burden. It leads to case delays or lost revenue, and it can decrease our OR efficiency. So if we can find the solution to those problems with a laser operator who comes in and relieves that burden, I think it's a win-win for everybody.
All right. Well, all those resources available to you. Just look it up in the description of this episode. Medical Laser Safety Checklist, a webinar on the Laser Safety Program ANSI standard, the role of the Facility Medical Laser Safety Officer document, and then a recommended structure for your laser safety program. A ton of great resources. And want to just thank everybody on behalf of Melanie and myself for listening to this Vendor Spotlight on First Case.
Thank you for listening to this week's episode of First Case. As a reminder, you can help support us by subscribing to First Case on your favorite podcast app or by downloading the smartphone app on iPhone or Android. Simply search for First Case in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@firstcasemedia.com. We look forward to hearing from you.